Have you ever woken up in your 60s and noticed you're no longer getting an erection? It's not just your age, it's your body trying to send you a message. And here's the thing, ignoring it isn't just costing you intimacy, it's affecting your confidence, energy, and even your heart health. Erectile dysfunction, or ED, is a common issue, but it's not just a bedroom problem. It's a warning sign that your blood flow is weakening, your pelvic muscles are losing strength, and changes are occurring inside your body that impact your overall well-being. But here's what no one tells you. ED is reversible. Yes, it's not just about pills or surgery. In fact, many men in their 60s, 70s, and even 80s have regained strong, natural erections without medication using simple, proven methods. These methods are rooted in science and tailored specifically for your aging body. I'm Dr. Mohit Kara, a urologist and men's health specialist with over 30 years of experience helping older men restore their vitality, confidence, and sense of power. Today, I'm going to share 4 specific exercises that you can easily incorporate into your daily routine to help restore blood flow, strengthen key muscles, and revive your sexual function naturally. 1. Pelvic floor activation, or Kegel for men. Let me share a story with you. One of my patients, a 67-year-old man, recently retired after over 40 years of marriage, came to see me. He looked down as he spoke and said, "I still love my wife, but I don't feel like a man anymore." Slowly, his erections had started to fade, and eventually he stopped having them altogether. No pills worked. But after just 8 weeks of simple pelvic floor activation exercises, he came back smiling, saying, "Doctor, I feel alive again." The key to his recovery was pelvic floor activation, or what most of you might know as Kegel exercises. Kegel exercises aren't just for women. They are one of the most powerful natural ways for men, especially after 60, to rebuild sexual strength and restore erections. Here's why. Your pelvic floor muscles control blood retention in your penis during an erection. When these muscles are strong, they hold blood in the erectile chambers, keeping the penis firm. When they are weak, blood escapes too quickly, leading to soft or short-lived erections. How to do it? Find a quiet place, sitting or lying down. Identify the right muscles. Imagine you're urinating and then try to stop the flow midstream. That internal squeeze is your pelvic floor. Contract the muscle for 5 seconds, then release for 5 seconds. Do this for 10 repetitions. Try this routine 3 times a day, morning, afternoon, and before bed. Consistency is key. In just 2 weeks, you'll start noticing firmer erections, better control, and even increased energy and confidence. Number 2, diaphragmatic breathing, or deep belly breathing. Now, let's talk about something simple but incredibly effective, breathing exercises. Let me tell you about a 72-year-old patient who came to me frustrated. Despite being active, he couldn't relax, and even during intimate moments, he couldn't get in the mood. His body just wouldn't respond. He was under chronic stress, his breathing was shallow, and anxiety was making it worse. What helped him most wasn't a drug, it was diaphragmatic breathing. It might sound too simple to work, but deep belly breathing, or diaphragmatic breathing, directly improves blood flow to your pelvic region, which is essential for erections. As we age, we naturally operate in a state of low-grade stress. Muscles stay tense, blood vessels constrict, and our breathing becomes shallow. This is the fight-or-flight mode, which reduces blood flow to the pelvis, exactly what your body doesn't need during arousal. How to do it? Sit or lie down in a comfortable position. Place one hand on your chest and the other on your belly. Breathe in slowly through your nose for 4 seconds, feeling your belly rise. Hold for 2 seconds, then exhale slowly through your mouth for 6 seconds. Repeat for 5 to 10 minutes, twice a day. Over time, this will relax your body, lower your cortisol levels, and increase blood flow to the pelvic region, which is key for strong, lasting erections. Number 3, penile vacuum pump therapy. Now, let's move on to something that might surprise you. Penile vacuum pump therapy. Now, I know it might sound a bit strange, but trust me, this method has helped countless men restore their erectile function. One man in his mid-60s came to me skeptical, asking, "You want me to do what with this thing?" But after 2 months of using a vacuum pump, he came back to me and said, "Doc, I'm getting real erections again, just like I did years ago." Here's how it works. The vacuum pump uses negative pressure to pull blood into the penis, expanding the blood vessels and improving circulation. Over time, this helps restore the natural erectile process. How to use it. Choose a medical-grade vacuum pump. Avoid cheap versions. Apply lubricant around the opening of the pump for a good seal. Insert your penis into the tube and create gentle suction. Maintain the suction for 10 to 15 minutes a few times a week. Using the vacuum pump correctly helps improve blood flow and makes your erections firmer and longer lasting. It's a great tool to restore function and improve performance. And finally, let's talk about penile extenders. This might sound like an extreme solution, but it has been clinically proven to help men improve both erection strength and penile length. One of my patients in his late 60s was reluctant to try it, but after consistent use, he came back and said, "Doc, my erections are stronger, longer, and I've noticed an increase in length." Penile extenders work through gentle traction, which stimulates blood vessel growth and tissue elasticity, essential components of a healthy erection. How to use it. Choose a quality penile extender that fits comfortably. Wear it for 30 to 60 minutes a day, gradually increasing time to 1 to 2 hours. Use it consistently for 3 to 6 months for optimal results. This isn't a quick fix, but it rehabilitates your erectile tissue and helps you achieve lasting results. Conclusion: take control of your health. As a urologist who's worked with men for over 30 years, I can tell you this: the most powerful changes don't happen overnight, and they certainly don't come from a pill. They happen when a man decides to take ownership of his health, quietly, consistently, day by day. We've covered 4 proven techniques today that can help you restore your sexual function, increase confidence, and reclaim your vitality. Pelvic floor exercises, diaphragmatic breathing, vacuum pumps, and penile extenders. All of these are tools that you can use to take control of your body and your sexual health. I know it might feel like a lot to take in, but remember, these are natural, safe, and scientifically backed methods that empower you to improve your health without relying on medication or waiting for things to worsen. By committing to even just one of these methods, starting today, you're already on the path to a healthier, more vibrant life. Don't wait for frustration to take over. Take action today. Your body and your life will thank you. If you found this video helpful, please like, comment with your thoughts, and subscribe for more actionable tips. Remember, you're never too old to take control of your health. Stay strong and keep moving forward.